There it goes.
Oh.
Good. The hip is out a little bit. There, it clicked. Did you hear that? So we're here with Oshoya. How's that one?
Good.
Good.
Perfect.
And who's the dog?
Her name is Sassy.
Sassy. Did I say that right?
Yes.
Good. And how old is Sassy?
Sassy is 15 years old.
Wow.
Very old lady.
How many kilos or how many pounds?
4 pounds.
4 pounds. That's a little Yorkie. Now, I have a whole playlist of Yorkies, so if you want to check it out, look at her playlist, and I'll put it in this card above, and you can click on and see the Yorkie playlist. And we worked with a couple of Yorkies this size. This might be the smallest, though. This is a real small dog, and she looks beautiful for 4 years old. Like, she has such a cute face, and notice the little tongue sticking out. Here, let's see the tongue. It's like this. I'm not making fun of you. I'm just noticing it. And so, how did you find us, and why are you coming in today?
On the YouTube, I saw your videos, and she has a problem because just one night she wanted to jump on the ramp, and she started crying.
The ramp to go up to the bed, or
Yes, to the bed, and she started crying just a few minutes.
And how many days ago was that, or weeks?
2 weeks.
2 weeks. And did you bring her to the vet at that point?
Yes, we went to the emergency room. They didn't find anything. They said she might be need a surgery.
Oh.
So
Why did they say the surgery? Where would the surgery be? On the lower back?
no, here the left side on this leg.
On the left leg.
Because they think she has a knee neck.
A kneecap. So some of the kneecaps on these smaller dogs get dislocated. It's also called a hypermobile patella or a luxating patella. Luxating means to dislocate. Like a subluxation is something slightly less than a full luxation or dislocation. So little dogs get these luxating patellas or hypermobile, or they move too much. They go in easy. Unfortunately, they go out again easy. Can we put Sassy on the ground and just see her move a little bit? And you can come down with us too.
She's too scared.
Yeah, so you sit.
She follow me.
Yeah, you're the mommy, so I'm gonna get out of the way. And she's really hopping, right?
Yes.
She's not even putting that left leg down.
No,
Do you guys see that?
Sometimes.
Yeah, and so that leg's been up in the air. Keep walking.
Yes.
Oh,
Sassy.
don't go that way. Can you see that at all, Helen? The back left leg hopping? And keep walking. Great film work, good work. Okay, so I've seen a lot, okay? What a cute dog. So listen, I'm sorry you're not feeling good. So what we're gonna do is we're gonna take a look at your whole body. We're gonna start with your neck. We're gonna come down your back very gently, because I know you're a little scared of me. And then we're gonna definitely look at your back left leg and see if the patella is something we can realign for you. How does that sound? I also wanted to work by permission to work with you today. I always like to ask for consent. And is it okay if we work together? Ask your mommy. Mommy, come over here.
Of course.
Mommy, come over here. Hold on to the baby. Even though you're 15, you're still a baby, right?
Yeah.
A little bit. Okay, is it okay to start? I think
Yes,
I'm going to
of
have
course.
you hold her the whole time.
Oh,
And I'm just
okay.
going to work right on top.
Okay.
Is that okay?
Yeah.
Okay, so let's check range of motion on the neck. And we're going to bring her head up. Oh, that's pretty good motion. The neck is moving really nice. You have a young neck. Good. And I do want to adjust a little bit at C1 on the right. So it's the top one. You can hear a little. No, I missed it. Got it. All right, good. And then a little muscle knot here at C5 on the right, so lower right. So she has some tension on the upper right, and then lower left is the problem. So she has contralateral issues today. And we're in here in this spot here. I'm also going to use this percussive instrument. This percussive instrument is soft, the one setting we use for the dogs. And we're just going to do a few things, and I'm also going to do your atlas too. Good, I got it. So now we're going to come down the back, And you just keep holding her, you're doing perfect. And I'm gonna come down the back, and I'm looking at every little spot. And right here, a lot of dogs get arthritis or DDD, degenerative disc disease, DJD, degenerative joint disease, same thing really. And it's kind of that arthritis, aging of the lower spine. And in humans, we get it usually lower. For dogs, they're getting it between the thoracics. They have 13 bones in their thoracic area, and then 7 lumbars. Humans have 12, then 5. Different species, right? So we're here, and the reason they get it higher up than us is because they walk on all fours. So quadrupeds, whether they're dogs or horses, we're gonna get their spot a little higher, while humans get it down here. Can you see that on camera? So up here is where dogs and horses get it. Humans get it more down here. But this is usually an arthritic spot. There we go. Ooh, did you hear that one?
Mm-hmm.
That was crazy, right?
Oh my God.
Perfect.
Okay, okay.
All right, so now I'm gonna hold her for a second, just like this, and
Okay.
start checking the kneecap, okay? So here's the knee right here.
Mm-hmm.
I know you're a little scared of me. So I'm gonna flex this. Let's see what the good side feels like so I can learn. Sometimes I look at the good side first. Okay.
The vet said they didn't know what is the problem.
Well, let's don't do surgery until we know what the problem
No,
is.
I don't want to.
Yeah.
That's why I came
Yeah.
here first.
Good. The hip is out a little bit. There, it clicked. Did you hear that? A little bit.
Oh my.
Good. I'm going to take your tail. There, it clicked a little too. So I'm going to have you come on this side here.
Okay.
And you're going to hold her facing that direction so we can all see this left side. Okay, I need both hands. And we're going to work on the
Okay,
knee
okay.
next. You can hold her any way you want.
Okay, like this.
So that you give her, no, but like hug her even. So she feels
Okay.
safe against you.
Okay. Okay.
Trying to get that knee in. The knee is out a
Okay.
little bit.
Okay. 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 Sass.
So does she always hold the knee up, or does she sometimes put it down and walk normal?
Yeah, sometimes put it down.
Mm-hmm. She also might be a little scared too. So as it heals, they sometimes get scared, and their memory is, I can't put my foot down. I can never put my foot down for the rest of my life. And so we almost have to give them a chance to transition to feeling better. So I'm in the hip now, and I'm gonna bring this up.
Okay.
You're gonna hold her, and I'm gonna lift up and adjust into here.
Oh.
There it goes. Okay,
Oh.
good. A little more. I'm not done. All right, I'm gonna put her on the floor for a second. It's gonna take her like 72 hours to respond to what we did today, but we just wanna see her move around a little bit. So she's still hitched up. I think there might be something with the hip too, so I wanna do the hip as well. So the kneecap I got in, but I think the hip is out. Now her leg's touching the ground, but she holds it up when she walks.
I thought first time the hip because a little bit.
Yeah, the knee was out. I just got it to click in. Now I need to look at the hip. So I think the hip is misaligned. So let's pick her up again.
Oh, okay. 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 Okay.
Stay there.
Oh. Okay.
We have this hip. I moved the hip. It's gonna take 72 hours for it to relax a little bit, okay, because it's been irritated. I wouldn't mind if you put ice on it, but do that for 10 minutes, hopefully twice a night.
Okay.
Okay, 10 minutes on, then
And
put
any
it back in the
painkiller
freezer.
or something?
Do you have any from the doctor?
Yes, because the doctor gave up.
Yeah, and is she still taking that? You can
Honest with you, no,
Okay.
because I don't like the medicine.
Okay,
If
so-
I see she has so
Okay.
much pain, but she
All right,
hasn't got pain
so
because
follow
she's
your
not
instincts on
crying.
that for now. All right, so we're gonna have to see this dog again and probably in a week and see how she's doing. Her hip was out, her left knee was out, but that was easy. And her neck was out on the upper right and lower right. And I also found at the thoracolumbar junction, I found this spot right here, but that was more achy, aging stuff because you're a senior dog. All right, thanks everybody for watching.